just go grab it.
I think we're live here.
No, they're muted.
Good level there.
Okay, so you guys are gonna have to fight each other.
Oh,
Did
Yeah,
you
I
want
think they
the lavalier?
yeah, I was gonna use that.
You guys ready? Hello, everyone. Welcome to the Paul Torrens Health Forum at UCLA. I'm Laura Erskine. I'm the director of the UCLA Center for Healthcare Management and director of the MHA program in the UCLA Fielding School of Public Health. On behalf of the UCLA Center for Healthcare Management and the UCLA Fielding School of Public Health, I want to thank you for joining us. Those of you that are here physically in our audience and those of you who are joining via live stream. Before we begin tonight's session, I want to thank the many donors who have made this program possible. We are very grateful for their support. As many of you know, this program was named in honor of Paul Torrens. For more than 40 years, Professor Torrens guided, mentored, and advised students in our school and beyond, helping many to shape distinguished careers in public health. It is with much sadness that I share that Dr. Torrens passed away on December 22nd. As Dean Brookmeyer shared in his announcement, creating a space for dialogue and advancing ideas among the healthcare, health management, and health policy community, both academic and practice-based, was a priority for Dr. Torrens. For those reasons, he created the forum, which was renamed in his honor in 2016. In 2019, the Paul Torrens Chair in Healthcare Management was established at UCLA Fielding, based in the Center for Healthcare Management and the Department of Health Policy and Management. The chair honors Dr. Torrens and supports the teaching and research activities of a faculty member with healthcare management expertise in perpetuity. The Health Policy and Management Alumni Association will be giving Dr. Torrens a more substantial tribute at the Leaders of Today, Leaders of Tomorrow dinner, which will be held this year on May 4th. Today, though, I would like to take a moment of silence to honor and remember Paul, and perhaps you can think about ways that you might extend his legacy by carrying on his dedication to mentorship. A few housekeeping notes before we begin. We encourage questions from the audience, and we will take questions towards the end of the program. You will see QR codes, like the one that you see here. If you use your phone to capture the QR code, you will have access to the bios, more formal bios of all of our panelists tonight. So whether you dream of becoming an entrepreneur or becoming a key part of an existing organization, your career will be touched by the role venture capital plays. Venture capital is backing new entrants that are challenging existing modes of care delivery, improving transparency, and improving access. We are honored to have with us this evening 5 distinguished experts who will share their experiences, their wisdom, maybe even their predictions on the role of venture capital. We'll get started with a conversation between Jack Schlosser, who is the executive in residence at the UCLA Center for Healthcare Management, and John Nackel, the CEO of Wavemaker 360. Jack and John?
Thank you. So, welcome everybody, Jack Schlosser, and just delighted to... Sure? Oh, turn it on. Thought it was on. Okay.
You turned off?
It was a trick. It's on. Let's see here. Can you hear me better now? Yeah. So we'll work on this. Make sure you hear me. Okay. So anyway, delighted to be here. Thank you for coming, and those of you who are joining us by streaming in, thank you for sharing part of your evening with us. And I would just like to say about Paul Torrens. I actually arrived the same year Paul arrived, and as Laura said, he would be so happy to see you here this evening. He would be so happy to know the topic that we're going to be talking about, which is about the future of healthcare, what's going on in healthcare, because he always supported the idea of having the community engage with the university and vice versa. And so one of my goals tonight, and the goal of our group that will be talking tonight, is to do just that, to perhaps stretch our thinking in terms of where things are going, and we will definitely leave time for Q&A. So as we go along, please keep that in mind. So my hope for tonight is that we will learn from the success of John, and I'm going to be talking about and asking him about his career shortly, his team, and also the rest of the panel. We're going to gain insights from the vastness of the opportunities and challenges facing the industry, and we were talking out in the reception how, as we all know, things are changing rapidly, and there are great opportunities and there are also challenges. We're going to hear opinions and see examples of what people are actually doing in the business at this point, and how they may impact your career, maybe even your life, no matter where you are in your career. You could be at the beginning of your career, mid, or those even later in life. All of these will be impacted to a certain extent by what's happening in healthcare. And again, we're going to provide plenty of opportunity for Q&A. So just to break down the evening, so you have a sense for what is going to unfold here, we're going to spend about 20 minutes talking about John's career, and then we are going to segue into Wavemaker 360 Health, which is part of his career, part of his story, but we're going to focus because there's a very interesting series of things that occurred leading up to Wavemaker. Then Kwame Ulmer is also going to join us, who is one of the venture partners at Wavemaker 360. And then we are going to have a really, I think, very exciting and insightful discussion, too, about one of their portfolio companies, Ready, Set, Food. And this, I think, may be the first time, I may be wrong, that a company funded by the Shark Tank is actually here at UCLA. And they can talk about their experience and what attracted those investments, along with also, most importantly, what they're doing to make lives better for young people and actually adults all over the world. So that's the background. Then we'll go to Q&A. Kwame, about 15 minutes. Katie and Daniel, about 15 minutes, and 20 minutes for Q&A or so. And we'll try to keep an eye on the timing so that we get everybody out on time, but we cover a lot of ground. So with that, let's jump right into it.
Turn the projector off.
Could we turn the projector off? Thank you. So my first question, John, is how did you get interested in healthcare?
I actually got into the healthcare industry at age 16. Like most 16-year-old boys, not men, I wanted a car. Getting a car was a big deal at age 16, right? So I see a few guys with smiles on their face. They know what I mean. So I applied to 3 different organizations for a job. IBM, Hood Milk Company, and Lawrence Memorial Hospital. Went in, did the application process. The first one that got back to me was Lawrence Memorial Hospital. And I worked in the purchasing department, central sterile, and a career was begun at age 16. Now, interesting comment, I'm going to give you a life lesson I learned at that point. Because I replied to Lawrence Memorial Hospital as soon as they made me the offer, I said yes. I got a call from IBM the next day saying I had scored the highest they ever had from a high school student on their exam that they give all employees. So they wanted me to come right back for a second interview and a job. And my mom said to me at the time, "You already accepted a job. You are taking the job that you already accepted." So instead of being CEO of IBM or Hood Milk Company today and getting free ice cream bars the rest of my life, I got into healthcare.
So I didn't realize you started in Central. I knew you started in a hospital, but my first job was Central.
Was that right?
And receiving. It's a small world. So, okay. You have a PhD in Health System Engineering, Master's in Industrial Engineering from the University of Missouri, a BS in Math and Economics from Tufts, 25 years at E&Y in the Chicago, Cleveland, LA offices. You led their global healthcare practice and their VC fund. And by the way, during the period when John was at E&Y, they were a monster of a healthcare consulting firm, and it was at its peak, in my opinion. You're a fellow in the ACHE. You became the CEO of Ingenix at United Health Group, now Optum. You have served on 3 public boards, 2 at healthcare, 1 insurance. You're the founder and general partner at Wavemaker 360 Health and a trusted advisor to healthcare leaders across the nation. What is wrong with you? You know, this is just a wonderful story of success and evolution, really, in a career. And I've watched John. I got to know him about 20 years ago. I knew of him before, and I watched his career since. And so when Laura and I were talking about what would be an interesting topic for the forum, John came right to mind to talk not only about what he did in his career, but how it's evolved, and we'll get into that now. So, John, so my first question...
Before you ask a question, can I respond to that introduction?
Yes, you may.
You forgot 2 things. I did have 1 other master's degree, so I want to mention that.
Actually,
But the other thing is, I've been married 46 years to the woman in the 5th row, and I have 2 daughters, one a UCLA grad and one a USC grad. So that's part of the success story as well. I don't want to make sure you add that to the list.
Yes, and welcome. So let's talk about success, that sustained success. What can we learn from your story?
Well, that's a loaded question, so I'll try to give some of the highlights that I believe are important in there. Number 1 would be mentoring and mentorship. I would contend that I've had 3 or 4 very significant mentors in my career And one of the things I've tried to give back over the years is being a mentor for health administration grads, for young people in my companies, various other ways of being a mentor. So both finding a mentor when you're young in your career and being a mentor later in your career. And I can mention a few that people will recognize some of the names. So Stuart Westbury was one of my early mentors. He was my PhD dissertation advisor. And Stuart was president of the American College of Healthcare Executives. He was CEO of 5 or 6 major medical centers, University of Florida, Michigan, Tulane. So he had a wealth of experience in the healthcare field. So Stuart was a great mentor for me. Also early in my career, Roger Nelson, who was a partner at E&Y. One that you wouldn't know unless I told you was Stephen Covey. One of the things I did with E&Y is I trained over 1,000 people in the 7 habits of highly effective executives. And I got to meet Stephen in that process, and we became friends. He's older than me, but in the past. But he was a great mentor for me in terms of how to develop the leadership in my organization. And interestingly, his son is a friend of mine. So Stephen M.R. Covey, who just wrote the book Trust and Inspire, a great book if you haven't read it. And by the way, I gave that to all my leadership team at Wavemaker, and consider it an important part of how we develop our leadership group in the organization. So mentoring, big part of my history. And the second is developing leaders. And those two things kind of fall together pretty quickly. You can only grow an organization and build an organization so much yourself. It's finding, recruiting, retaining, and building the leadership team that drives your organization, whether it be a 10-person venture fund or a 5,000-person Optum group that I was CEO of. So building that leadership team is a very critical element. The other element that I would say is important is culture. I'm a big believer, and you've heard the statement, culture eats strategy for lunch. Well, I'm a true believer in building a culture of an organization as a cornerstone of how you run your business. And interestingly, even the public companies that I'm involved in, maybe it's because I selected them or they selected me, but culture is a critical part of Ensign, Pennant, Mercury, some of the companies that I've been a board member of.
And that point about culture, in my previous life, I spent many years in executive search, and one of the things we clearly came to understand, and many of you understand, is that when things don't go well for the fit, it's often because the culture is not a fit. And so that when looking for positions, that mutual fit is so important. We've talked in the past about also the fact that you've gone through evolution in your career, and you've used the word pivot. You've pivoted a number of times in your career, and we've talked about agility. Could you talk a little bit about that?
Yeah, the point about pivoting is this. The world changes, the marketplace changes, the industry change, and if you stay stagnant, you're not going to be anywhere next week or next year. So you've got to pivot to the marketplace. And I'll give you some examples. Many of you are way too young to understand this example, but when DRGs came into place in the early 80s, it was a basis for how hospitals got paid. It started with an experiment in the state of New Jersey. New Jersey got a Medicare waiver and paid for their hospitals for Medicare services using DRGs. Well, that was my pivot. I became the world's experts on DRG. I was giving speech once a week, every couple weeks, somewhere in the United States. And I built a specialty skill, and I also got recognized for it inside the firm too, so it allowed me to, I made partner very young, and the result was I was this expert in an area. So you start with a very special skill, then you become a generalist later in your career. It's often Daniel becomes a CEO. Well, some days he's washing the bottles, some days he's the CFO, some days he's the chief boxing guy and putting the bars in the boxes. And Katie, the same thing. She's speaking in front of a group about allergies, and you become a generalist on your topic, and then you become a specialist again later in your career.
But I also hear you say you recognized a major shift that played to your strength, and you rode that wave.
Exactly. Surf rider.
Right.
Yeah.
Yeah.
Wavemaker.
Wavemaker. That's right. So disruption. The industry's going through great disruption right now. What's your feeling about that? What are your thoughts about that?
Well, there's some huge disruptions, and some people credit it to COVID and a pandemic, but many of the issues have been around a while, and they're not new. We went through a nursing shortage in the 80s, for instance. We've got a huge nursing clinical issue today. You've got side by side in this building, UCLA Medical Center, or across the street at Cedars, a nurse making half the amount of a nurse right beside him or her. They outsource the business, and about a third of nurses in some medical centers are outsourced today. So you've got a bigger problem with morale, you've got a problem of engagement, you've got a problem of technology. Do they know how your information technology system works, your Epic system or your Cerner system or whatever? So there's big disruption going on in the industry right now, and I think the best way to fix it is innovation. So I'm seeing innovators every day, and the types of things that are coming up today are just huge impact on the industry. Artificial intelligence is a good example. You talk about disruption. I mean, it's the way physicians practice. It's the way people manage a business. Marketplaces. The example I just used on nurse shortages. One of the biggest in the market today is a company called Trusted. Trusted is now a $600 or $700 million valuation. Luckily, I invested in it at $16 million. But Trusted is filling all those nurse roles that I talked about a few minutes ago. And it's got a Uber-type marketplace for doing that. High technology, AI-assisted type product to disrupt that whole market.
And you feel that the scale of the innovation will help to, I won't say overcome the disruption, but keep the industry and keep our healthcare industry healthy?
I do, except I'll make a qualification to that. This is the slowest industry to change of any industry anywhere. We're 10 to 15 years behind on technology at any given point in time. 1990, we were 15 years behind. 1999, we were 15 years behind. We're still 15 years behind. In fact, I have a sign in my office that says, "Fax machines kept alive by the healthcare industry."
So,
They wouldn't exist today if it wasn't for the healthcare industry. It's the only industry that's still using fax machines every day, every place.
and yet, so you have been an innovator, and yet you've also remained, you're a fellow in the American College of Healthcare Executives. You stayed in the industry. What's kept you focused on healthcare?
The reason I went into health administration first and then health systems engineering was to make the system better. I truly believe there was opportunity from a career perspective to make the industry better. And since it hasn't got there yet, there's still opportunity. So I've spent, I stopped counting, but 40 plus years, whatever, in the industry, and there's still opportunity. It's a great career for anybody going into healthcare.
Right, so
And the other thing I was going to say is I had at least 5 or 6 people come up to me and they want to introduce me to their new product or service. The great thing about being a VC is you have money, and entrepreneurs love people with money. So it allows me to meet people because they come right up to me. Kwame's the same thing. And Kwame goes to a meeting. He's got flocks of people around him when he goes out. Part of it is because he's good looking, but part of it is because he's got money.
So, what advice would you give the attendees tonight if you were thinking about where to go? And I don't want to get ahead of ourselves, but I'll ask the question. What areas of healthcare would you, for enhancing a career and having an impact, where would you direct them?
I would say that any entrepreneur that's bringing technologies that are used in other industries has a great career opportunity because there's so many things. Kwame probably sees 20 medical devices a week these days, and we can't fund 20, but we'll find 1 or 2 really good ones. Companies like Ready Set Food, we literally will see 30 companies for every one that we invest in. So there's lots of opportunities in those areas. In health administration, anybody that's got an interest in managing people, building leadership, growing an organization. There's a whole generation of health administrators that are at retirement age right now. Huge numbers that will be leaving in the next 10 years. And as a result, health administration has big opportunities as well. The payer world is broadening. So you look at like a United Healthcare, Optum. If Optum was spun off as a separate company, it would be a Fortune 50 company. That's how big this enterprise is called United Healthcare. It's a Fortune 20 company, but Optum itself is a Fortune. It'd be bigger than Disney, just to put it in perspective. So here you've got this great enterprise. So, and I like companies like that because they like to buy some of the companies that I have in my portfolio. And all of the big healthcare vendor, provider, professional services firm are noted for one thing more than anything else. They're not very innovative. They're not innovative. McKesson, J&J, you can go down through the list, Optum, Anthem, all these companies are very uninnovative. So innovative companies, what they do is they buy innovation. They would rather pay for revenue and net income than they would invest in innovation.
So we're about to segue right into Wavemaker, but before we leave the kind of the topic, the general topic of both your career to this point and thoughts for the audience here, if you had one piece of advice about careers, what would you give this group?
I go back to the starting point that I said, mentoring, leadership, culture. Those would be the areas that I would concentrate. If you find an organization that doesn't have the culture that you want, don't go there. The best advice I ever got as a young professional in the industry was surround yourself with people that generate energy. I have used that many times in my hiring process. There are people who create energy and there are people who suck energy. And if you get surrounded by people who suck up energy, you're going to spend all your time on things you don't want to do. So
Very interesting.
hire and surround yourself with people that give energy, not take up energy.
Wow, thank you. All right, so I think we're about at a point where we should actually segue into Wavemaker, and we want to cover some history, and we've got some slides we're going to put up here, and John's going to take it from here.
He said it does work. I can do it manually if we need to.
We'll start here.
There you go. I'm fine.
Sorry.
Okay, so I emphasized team a number of ways, Jack. And so I'm going to start with team. And you'll notice the variety of skills and diversity of the team. What I don't see in too much in healthcare is that diversity and the skill sets there. And I'll give you an example of that. When I made partner at Ernst & Young, you know how many women partners there were at E&Y? Zero. And when I took over the healthcare practice, there was one woman partner. By the time we sold to Capgemini in 2000, we had 40% of our partners were women. And I believe, and I did it as much for strategy as anything else, the marketplace was women buyers. There was CEOs, nursing directors, a lot of the leadership in the industry. The same thing with minority groups. So you'll see a lot of diversity in the team that we've assembled. My other general partner is Jay Goss. Jay is the yin to my yang, where my experience is all healthcare and deep in healthcare and big companies. His background is 100% with early stage businesses. He's run some, he started his own companies, and he's understands what the issues that entrepreneurs go through. Eric Martin, a couple people came up to me and said they were friends of Eric. Eric was at UCLA, he was at Cedars, he ran the Heart Institute at Cedars, and he was at Verity Health. So he's a provider type background, strong provider experience. Tom Zenti, many of you know, was the Chief Operating Officer here at Cedars-Sinai. And over the last 20 years built up University Health System in Cleveland. It was a 3 or 4 hospital system when he went there, and he built that before he retired last year to a 26 or 27 hospital system. So strong provider experience on the top row. Kwame, who you'll get to meet in a little bit more detail in a few minutes. gave us a totally different dimension. We didn't have deep experience in medical devices. So we went out and got a guy who spent his career at the FDA approving of medical devices. Kwame, how many devices have you seen over the years? 1,000?
About 1,000.
Yeah. So with a guy who's seen 1,000 devices, I can't make decisions about investing in an early stage company in the device world. I need a guy like Kwame around me. Monica Jane is a physician. She's at Cedars, a surgeon at Cedars. And Monica spends 75% as a surgeon and 25% of her time as a venture fund partner. So she was just on the phone with us this morning. We looked at a company that I could not evaluate that company without somebody with her depth of experience. Likewise, Dimi Barreau is a venture partner physician. He's a speech specialist, neurology specialist, Yale-trained physician. And you might have seen him at the All-Star game for basketball last week. He is the sleep expert for about 20 or 30 of the top NBA players. So he's a valued skill set that we don't have otherwise. And Max is our guy who leads our due diligence process. So the taking a company from the top of the funnel to the bottom of the funnel is what Max does for us. The second thing, so I've mentioned people from inside. What are the people who are our investors? Our investors, for the large part, are healthcare people. Out of 250 investors in the company, well over 200 of them are from the healthcare world. They're hospitals. Some of our investors are corporations, and some of our investors are C-suite executives, and a lot of physicians. We probably have about 50 physicians. So how do they help us? What does that differentiate us from other venture funds? Most venture funds can write a check. We can write a check, and then we can do everything on the right side of the board. Our limited partners get involved in sourcing companies. They get involved in due diligence, second opinion on companies, and they get involved in supporting a company. So I'll give you an example of a company called Third Eye Health. It's a skilled nursing product, telemedicine for the middle of the night. A patient has an episode. There's no physicians in the skilled nursing facility in the middle of the night. So what do? You put the patient in an ambulance, you send them to an emergency room, and they incur all these costs that are really unnecessary. So what Third Eye Health did was they went out and set up a telemedicine company. You call their telemedicine company. The nurse is on a tablet and talking to a physician that's off-site, and 95+% of the time that patient never gets in an ambulance or goes to the emergency room. So look at the cost impact, the disruption that causes there. Direct result of our support. One of the companies that's in our portfolio, one of the companies that's in our investor group is a company called Ensign. Ensign is a operator of close to 300 skilled nursing facilities, and they took that Third Eye product and put it in their healthcare, their telemedicine. Started in Texas, and now about 30 of their facilities in Texas use this product. So quickly about the process. What is the critical element in investing in good companies? It's not investing in bad companies. It's really true. We start with, for our first fund, we looked at 900 companies. We only invested in 32. one of which you'll hear about in a few minutes from Katie and Daniel. So you guys made the cut, 1 in 30. The top of the funnel is the other key. You got to get good companies in the funnel if you're going to get good companies out of the funnel at the bottom. So we use dozens of different ways of getting companies in the funnel. Our industry partners, our limited partners. We go to events. We have relationships with about 20 different universities around the country. We have cold calls. We get other VCs. We don't look at other VCs as competitors, Jack. We look at VCs as our partners.
Did I see that you never invest just?
We never cowboy invest. We invest with other VCs, with hospitals. We've invested with Mayo Clinic. We've invested with Cleveland Clinic. We've invested with Cedars-Sinai. So we invest with others. We don't try to cowboy invest. And then we have a process to get that down to that bottom level. One event we call Surf Camp. It's the equivalent of that Shark Tank that you see on TV. We bring in 5 or 6 companies once a quarter, have them, used to do it in person, we mostly do it by Zoom these days. And as a result, by the time they get through that process, this is when I see them. So we start with 900 companies, and I probably don't see a company till there's about 100. So 1 in 10 of the top. And then we have a more refined process in terms of the investment committee, and I chair the investment committee of our firm. And guys like Kwame will come in with a medical device, and he'll do the pitch and why we should invest or how much we should invest and our strategy for that company. I'm going to give you one example, and then we're going to get into some of the successes of the company. So this is Ready Set Food, and you're going to be hearing a lot from them, but I'm going to toot their horn a little bit to start. And that is, this is our process. Our goal is this exit. We have a bullseye up there, whether the exit is a sale or an IPO, a great company that we own, whatever it might be. But we invested in Ready Set Food very early, a small check. We didn't write a big check, but we were one of the first at the table with them. They had the opportunity to go on Shark Tank, and Katie and Daniel will give you that experience in a little while to tell you about that. But what our process is, what's at the top there? Reward good behavior. If the company does the things you want it to do, you put more money into it. And if they're not doing the things you want them to do, then don't put any more money in it. So we start with a smaller check, and then we keep adding to the size of that check over time. And we always ask for pro rata rights. So once we've invested in a company, we have the opportunity to keep our ownership stake as we go. And in this particular case, they were interested in the formula world. So I remember one call that I set up for Abbott. Daniel said, "Can you get me into Abbott?" And I said, "Yeah, I think I can handle that one." I had a great relationship at Abbott, and they showed up, and Daniel said, "Did you know they sent 5 people or 6 people? I forget what it was. They had a pediatrician, they had an allergist, they had their formula person, they had their..." Well, for Daniel to get that kind of a meeting probably wouldn't be too easy. So the Wavemaker relationships and one thing I didn't mention earlier, Jack, in terms of career is keeping relationships. I would say that was a major part of my growth over the years, is always building on those relationships. And in fact, several of the people that are on that chart that for my team were because of relationships. I've known Tom Senti for 30 years. I've known Eric for 20 years. Never worked with me, but gradually over the years I got to work with them and had the opportunity to bring them on. So again, we're going up that path. You'll hear a lot more about this company. But our goal as a venture fund is we're looking for a 10, 20, 30x multiple at the time of exit. Now, if we invested in 32 companies, we're not going to get 10x on every one of them, but we're expecting about 1/3 of the companies to just go away. They're going to go out of business. We're going to expect about 1/3 of the companies, it's going to be a long haul before they do great. And then it's our hope that about 1/3 of the companies are very successful. So, Daniel, Katie, you're still in the top third. Let's do it, babe.
No pressure.
So, what are the results? And I'll just give you a few of the highlights here. And I'm going to emphasize a few companies in particular. So, this is supposed to be a continuum, but I'll go randomly through here. First of all, we've had one company that's already been predicted to be a unicorn. I mentioned it earlier, Trusted. It's already valued at about $500 million. It was written up in Forbes as a potential healthcare unicorn. It is not our most valuable company right now. We have two that have a higher valuation already. And they're in that second category. Iterative scopes. I mentioned using artificial intelligence in healthcare, Jack. I think artificial intelligence is going to have a huge impact on this industry. And I'll give you the example of iterative scopes. They take a artificial intelligence software along with a scope for a colonoscopy. So they scope you, and then they have the information fed into a software computer, and have now got several 100,000 patients that have been through this process. And as a result, that artificial intelligence gets better and better and better. That scoping using artificial intelligence now picks up 3 times more polyps than the naked eye. So when you talk about improving healthcare, earlier detection, earlier treatment for cancer, and the opportunity to supplement, we're not talking about replace the physician judgment, but to supplement the physician judgment, I think it's a great company. I think it's going to be a world-class business. Triple blind, Ready Set Food, we've already talked about. Deep Scribe takes the conversation between a physician and a patient and turns that into a medical record, turns that into the physician note. Physicians hate taking notes. Physicians hate the whole administrative things that they do on a day-to-day basis. And by the way, they take about 30% of the physician's day right now. So anything that applies to reducing that physician administrative burden has a huge opportunity. So that's another. I'm not going to go through all these. Go through my website if you want to know more about some of these companies. We have an exit with Avid Science. We had an exit with MedPilot. And by the way, MedPilot was acquired by Vitalize Health. Vitalize Health just closed yesterday, $100 million round of funding. I don't know what the valuation was, but on a $100 million round of funding, I suspect it's in the high 9-figure type level at this point. That just happened in the last few days. Citizen already got sold. Says we invested at a $16 million valuation. And interestingly, we invested with Andreessen Horowitz. That's the A16Z. That's Andreessen Horowitz, A and Z at the end, and 16 letters in between. That's what they use as their symbol. I put it up there. But that company sold for $550 million. Now, the interesting thing was they were sold for stock, and we got stock and cash. And when we got the stock, my partner Jay comes in and says, "What do you want to do with the stock?" I said, "Sell it today." And he said, "Well, what do you mean?" I said, "Its PE ratio is 116. Sell it today." The stock is now about 80% down from when we got the stock. So sell it today was a good idea.
I want to be a little bit of a timekeeper, and you want to make sure.
I'm almost done.
Okay.
I want to mention two more things here. You're going to hear plenty about Ready Set Food. Carlsmed is an interesting one because I think it's a company that you're going to hear more about, which is personalized medicine for spine surgery. So personalized medicine, in the old days, the orthopedic surgeon walks into the room, the operating suite, with a box of parts. That's the best way I can describe it. Finds the part, fixes it, puts it in your spine, and you walk out and it never fits right. And you're back in for surgery again in 6 months, 2 years, 10 years. The whole idea of Carlsmed is they do imaging, 3D printing of the part, then they make that part into a titanium product. And if you have any questions about this, ask Kwame, because he's the expert on this company and is our sponsor for this particular company. The last thing I wanted to say, and I wanted to close with, was Silicon Valley is notorious for not investing in women. Silicon Valley is notorious for not investing in minorities. Our fund has invested in 55% are minorities or women. I think we might double count there a little bit, but we are well ahead of the market in that regard. And I believe that's part of our success. I believe that's the Katies of the world working with the Daniels of the world are better than if one of them tried to do this themselves. So I'll let them tell you that story if they think they believe that. So should we bring up Kwame?
You want to do the initial intro of Kwame, and then I'll start with some questions.
Yep.
Yeah. Come on up.
You got the hot seat.
Yeah, I'm between the audience getting to hear the Shark Tank story, so I'll be brief for sure. Much more interesting story, I'm sure.
Well, based on our conversation, I think people are going to want to hear a lot about what you're doing. But you want to talk about how the two of you connected up, or Wavemaker and Kwame? Then I'll.
No, I'm going to let Kwame tell that story.
Okay.
So my wife and I had moved to Los Angeles, and I had started some angel investing, and I was building up my regulatory strategy consulting practice. And I decided to host a panel and include a local VC. And in walks Jay Goss. Jay Goss is a general partner with John Nackel, and we struck up a relationship, a professional friendship. And what, after a couple conversations, we discovered was I could add real value as a member of the team potentially, because I had complementary, not redundant background. And my background was in regulation of medical devices, digital health solutions, and diagnostics. And after a couple conversations, and I think the timing was really good because we were raising a fund and all those things worked together. I was willing to spend some time helping the team raise a fund. We worked together on raising Fund 1 and investing out of Fund 1. So that's our story.
Good. So we're now gonna go back in time and talk a little bit about the highlights of your early years, but just to recap, from an educational standpoint, everybody, BS Physics, Lincoln University, a master's in Materials Engineering and Business Administration from UVA. And I guess the first question here would be, what are the highlights of those early years and your journey from UVA to the FDA? And then we'll get into shifting into the private sector.
So I was interested in medical devices as a teenager. I thought orthotics and prosthetics were just some of the coolest technologies out there. And a mentor of mine encouraged me to apply to University of Virginia. He had gone there. And I met with a graduate, who turned into be my graduate advisor. He said, I'm studying this material called nitinol. It's going to have a lot of applications in medical devices. And it was between going to school in Charlottesville, Virginia, the University of Virginia, or going to the University of Akron that also had a really strong polymer science program. Nothing against Ohio, I chose UVA. And from there, another UVA grad encouraged me to apply to a role at the FDA because a lot of the materials that they were evaluating were based in nitinol, and I had studied it. So John mentioned about getting deep domain expertise. My original domain expertise is in this material called nitinol that ends up having a lot of medical device applications, and the rest is kind of history after that.
Wow.
Yeah.
I would add a couple things here. So this guy is now called a venture partner. He did not know how to spell AUM when he joined us, and if you spotted him the A and U, he'd still struggle on it.
That's right. That's right.
He has grown as a partner. He really deeply understands the medical device business, and what he's grown on is learning the venture world and the process and the due diligence and the sourcing, and this guy is tremendous at that, and he gives back to the marketplace as well. He started a group called
MedTech Color.
MedTech Color, for instance, and he's really dedicated to bringing other people along and mentoring them. So he's a great partner.
Check's in the mail, so thank you, John.
And you must have done pretty well at the FDA, 12 years, and ended up deputy director.
Yeah, it was an opportunity at different stages to grow and learn, first as an individual contributor, then as a manager of scientists and engineers who were evaluating these technologies. And I was fortunate enough to leave managing a group of about 50 scientists and engineers and sign the clearances, the marketing approvals for devices in a range of areas, which led me to a position in corporate America later.
So go ahead.
I was going to ask you about a company. So I mentioned Carlsmed.
Yes.
Tell us a little bit about the process of how Carlsmed came to you, what you saw in that company, the whole FDA process issues, a little bit of the background and why that whole precision medicine applied to orthopedics, spinal surgery made so much sense to you.
So I met the CEO probably a year before we invested at a conference called the Medical Technology Innovation Forum down in Irvine, California. He already had a strong background working at large medical device companies, and he fit the profile of a classic medtech CEO. He had cut his teeth at Johnson & Johnson and Medtronic, those firms. And in the beginning, on the surface, he was just building another spinal device company. But as you mentioned, John, he was doing much more than that. He was building a personalized medical device. And eventually, the promise, as AI is incorporated into the software, is to be able to show through outcomes data that there's a lower revision rate. And oh, by the way, every time you use his device, he gets paid $50,000. So speaking about venture grade company, he can scale quickly. So those are some additional aspects of that particular company that John, you teased me. I said, this is a no-brainer when I brought it to the events committee. I said, this is a no-brainer. We got to do this deal. And you said, well, there's no such thing as a no-brainer, Kwame.
Pretty good. Pretty good.
But the IC approved it, and it's one of our more successful companies. Yeah, Ready Set Food is a no-brainer.
You're also involved with MedTech Impact Partners. Can you tell us about that?
Yeah, MedTech Impact Partners is a regulatory strategy firm. And what I love about working at that firm and having built that business is sometimes we meet companies that are a good fit for Wavemaker 360 Health, but it also keeps me abreast of regulatory policy issues that will affect our portfolio companies. So I'm seeing pharma companies investing in prescription digital therapeutics companies, and I can bring that back to Wavemaker. So hopefully we're ahead of the curve in how we think about these trends that are in the future.
Right. And we really didn't hear from you the transition into the private sector. Could you talk a little bit about that whole?
Strangely enough, there are two parts to it. I met a gentleman at the FDA who was a Kaufman Fellow. Kaufman Fellow is probably the oldest training program for people who want to enter VC. And I knew at that, it was about year 11 or so, I wanted to enter into the private sector because by that time I had looked at hundreds of medical device applications, but I wanted to be a part of a team building it. But I was also intrigued by VC. Parallel track, I applied to University of Virginia's business school. So I got into business school in this Kaufman Fellowship. The Kaufman Fellow said, you have to pick one. I picked business school. I think I made the right decision. And in the middle of business school, I got a role at Danaher. Danaher is actually you can think of it as a GE that's pivoted more to a GE healthcare, a science and technology conglomerate. Brought me out to California, and I reported to the president of a company that was building medical devices, and did that for about 4 years.
We have a running joke in the company about who has the best blazer, and he always wins. It's just not fair. He must have a closet full of these blazers.
Well, when you told me you were going to come with a Brioni suit, I figured I had to try and keep up a little bit. I had to level up, as they say.
So do you have an infrastructure at Wavemaker? Kind of what do you have a team?
So within the group, there are some that are particularly passionate about traditional medical devices. Monica Jane is one. I consider her a partner in crime. Really, when she joined the firm, she gave us unique insights into clinical adoption, which is a major piece of the puzzle at the time that we're investing. Another member of the team is Prenia Prelicure. She's a Bruin. She's an Anderson grad, and she has nearly 15 years of experience building medical devices. So between my regulatory background, Prenia's background in building medical devices, Monica's background in learning how and knowing how companies gain adoption, and we have a team member based in Northern California who's in another ecosystem. We have a really tight group of folks that can provide unique insights in diligencing and supporting medtech companies.
The other thing that happens, Jack, is because we have such a strong medtech team, other venture funds will come to us and say, you guys do the due diligence on this. We'll throw in money. You just do the due diligence. So Kwame and his team will do the due diligence, and then suddenly we might put 500,000, but we've got another $1.5 million that comes in just because they have so much confidence in our team.
What are some of the areas that you're very excited about going forward?
So I was visiting with my cousin in San Diego. He's a retired nephrologist. He sits on the board of Scripps. And he said, Kwame, we had this presentation about the benefits of technologies that allow you to heal in the home. And I thought to myself, I think we're on to something, because that's a bit of a thesis we have. Technologies that enable you to heal at home is a mega wave. That's one. Another is personalized medicine. We talked about that. And then I feel like we're in the middle of this wave of digital health solutions. The first wave was image analysis technologies that could screen and say you're at risk for condition X, to prescription digital diagnostics and prescription digital therapeutics that can definitively say to the doctor, we think you're at risk for PTSD. That's an exciting time to be in the healthcare sector, and I think that area is going to grow. Yeah.
One of the things I meant to ask John, actually I'll ask both of you, when you invest in a company, how, on the weighting, if there is such a thing, how much do you weight the founder leadership team against historical operations or the sector? Kind of, how do you do that evaluation?
So I'll give my thoughts, and I know John, I'd love to hear his thoughts too. I think the founder is quite important. With Carlsmed, we knew that he understood medical devices. We saw from his initial management team, he knew how to attract top talent. Similarly, there's a company who had a scientist CEO, the CEO of a company called Functional Fluidics. He understood the first indication because he did graduate work. He's an MD, PhD in sickle cell, and he developed a diagnostic test for sickle cell. But he had shown us early signals that he could actually generate revenue, which is a sign that you can grow a team. But I think team is quite important. And I think, John, would you agree?
A couple things I would add to that. When you're investing in this kind of business, you're investing in the jockey as much as the horse. So we've got examples of a CEO that couldn't take the company to the next level in terms of raising capital. But they knew that. The person knew they weren't going to be able to do that. I'm happy to invest in that person. I'm not willing to invest in somebody that can't raise capital and wants to be the CEO forever. If they want to be the CEO and they can't do the steps of the job that it requires as you grow, then we can't invest in that kind of a company. But a good scientist or a good clinical person, but they know I'm going to have to bring in somebody for commercialization. It may be even a CEO to replace me. And they know that, I'll invest in that. That's a good jockey.
And as I understand it, some of the firms, the venture capital firms, have operating partners where they will kind of embed them in the organization. Is that something you folks have ever done, or kind of what's your philosophy on
We
that?
tend to advise, but we don't embed anybody in. We often will put somebody in as a board member or a board advisor, but not operating. We don't get in an operating level at all.
And in terms of, because these are early stage companies, where perhaps some, whether it's support, leadership support, coaching support, whatever, is that what you get involved in, or are they pretty much on their own?
There are two companies. One I'll talk about because we're going to have a call with them tomorrow. It's a women's health company called Materna Medical. They have some early outcomes data to show that they can shorten childbirth because they protect the pelvic floor and reduce injury to the pelvic floor. They had a regulatory matter, let's just call it a matter, and they had internal regulatory consultants to provide them feedback on how to get through it. But fortunately, because I've been doing this work for 20 years, I served as a second opinion as they thought through how to quickly navigate this matter, which is done with now, and sell their first version of their product. And we do that regularly when someone has a skill set that's appropriate. Just on that call earlier today, Eric Martin may be able to fill a board role for a particular company that we invested in. I love that about the group. We are democratic about picking the right person to provide the right advice at the right amount of time, at the right time.
I'd like to have you explain to the audience your background with MedTech Color, what the purpose of the organization is, and where it's going.
So when I was at Danaher, we had a meeting of the top 100 leaders of a $4 billion platform, and I was the only person of color in that group of 100. And I said to myself, that isn't quite right. that just isn't right. 5 years later, we have an organization, a nonprofit called MedTech Color. It has three main purposes. One, to build community, because quite candidly, it can be lonely as a healthcare executive of color, because the numbers reflect that, and we know that more people of color, more diverse teams drive better outcomes. Second thing that we do is we directly invest in early stage companies that are managed and controlled by people of color. We've invested in 30 companies in partnership with organizations like Johnson & Johnson, the NIH, so that we give them non-dilutive capital to get from pre-seed to seed stage, but they also get access to J-Labs, founder and residence programs at companies like ResMed, et cetera. And the third thing we do is we run a program called Collaborative Community, which is focused on diversifying clinical trials. The FDA just mandated that clinical trials must be diverse, and we have a partnership with the FDA to put out best practices to help companies diversify clinical trials.
And that problem with the clinical trials absolutely affects medicine, the way it's delivered. And I'll give you the example of heart attacks. So women experience a heart attack differently than a man experiences a heart attack. Jerry Pohost did the work on this at USC a number of years ago. And yet, most of the clinical trials over the years for heart attacks was men. Because men had more heart attacks, so therefore, as a result, they worried about that category. And yet, women had totally different experiences of how they got a heart attack.
By the way, I promised that we're going to have Q&A, and we also want to make sure that our next panel members, so come on up, gang, and thank you, Kwame. And yeah, stay, Kwame, please. And John, maybe you would do the honors again of some introductions here.
Do you want to show your slides?
I guess we can do questions first.
Okay, okay.
We'll start with a few questions,
Yeah.
and then we can pop up your
Yeah.
PowerPoint. So, one of the things that we found with investing in early stage healthcare companies is the passion of the founders. And we found that with Daniel and Katie when we looked at this company. And oftentimes it's personal experience, some reason they got into the business that they did and started the company that they did. So I'd like to have you two share your story of how you got together, how you ideated this opportunity, and then we'll go from there.
Well, thanks, John. So we started the business about 5 years ago, really starting after my nephew developed severe food allergies. Katie's an allergist and has a much more extensive background in this area, but it was really new to me and my brother-in-law, whose son developed these food allergies. So I think for us, my brother-in-law and I started talking about this initially after his son developed these food allergies, seeing that there was so much evidence that had recently come out that most food allergies could be prevented through introducing allergens into babies' diets, starting from a young age and doing it frequently. But we knew we really needed an expert. I think the converse of what John was talking about, that sometimes you find a doctor that really needs a business person. I think we had an idea, but knew that we really couldn't do this without medical expertise. That really from the beginning, helping us think through what the product should look like, how it should be formulated, what kind of other medical experts we should bring in the room. So I think you're really seeing that personal experience of food allergies affecting my nephew and how much of an impact it had on his life and how much of a difference we can make in so many other kids' lives. I think that's what's really helped drive me. But I think knowing from the beginning that because it was something that was so medically sensitive, that it was really critical we did everything with a medical perspective in mind was really important.
Just to make it a little more sappy. So what really happened is Daniel's nephew at about 7 months of age developed multiple severe food allergies, and his father, who's my friend, our other co-founder, and Daniel's brother-in-law, is a very smart guy. And he had known about the recent science and sort of the developments in food allergy and food allergy prevention. But he knew that he couldn't feed his child early enough because a lot of babies don't eat at 5 months or 6 months. A lot of parents aren't ready to feed them, or they're just not able to eat. Anyway, he couldn't feed his child, and he knew that early allergen introduction, meaning getting allergens into babies early, was a way to possibly prevent it. So he got together with Daniel, I think you guys were on a hike, and he said, what if we could put allergens in like a bottle or a passy or just something? Can we get them into babies another way that doesn't involve eating? And they thought of this idea, and I think called a few people, discussed, and then I was lucky enough to get a call from Andy driving home from work one day. I had a commute back then, and thank God I don't anymore. And I spent my whole commute, I think it was an hour, on the phone with Andy, and just, I still remember that call and the excitement and the feeling that I had with this idea, and I just knew that it was going to be something. And so anyway, we got together in Daniel's living room and used a whiteboard, and just that typical startup, sitting on the couch after work, coming up with ideas. And we had another friend, who's your friend, who's a food scientist, and the four of us got together and created it. And the rest is history, but it was exciting because there was personal involvement, there was a passion, I think from all of us about the topic. The science really had no holes in it. That's another thing. The science was very concrete at the time, and it's evolved and even gotten better. So having that science and the right idea, and that's how it came to be.
What I think is really neat about this is when you think about your backgrounds, serial entrepreneur, UCLA MBA, allergist, board certified, trained it with CHOP and do adult and pediatric allergy, and still practice. So keep that in mind, everybody. If you, but it's a great coming together in a timely way. And I mentioned this to a friend of mine who's a family practice doc, and he immediately embraced the concept. He said the interesting thing, and correct me if this is incorrect, but he said what they're doing today is in fact the appropriate thing, but it used to not be thought to be. The guidelines were different, or could you talk a little bit about that?
Yeah, sure. You also, I think you have your I think it's behind you.
There's a microphone.
Oh, okay, sorry. You're gonna share. So you're right. And this actually goes back to what John was saying about how healthcare is the slowest sector to change. And that's one of the biggest hurdles that we've dealt with as a company. So back in 2000, the American Academy of Pediatrics put out guidelines recommending that parents basically avoid allergens early on and wait until 2 years of age or 3 years of age to feed allergenic foods to babies. And then in 2008, they actually reversed that guideline, but they didn't really publicize it. They didn't want to publicize that it was really only based on 2 observational studies, not any good randomized controlled trials. So over all of these years, parents and pediatricians and family practice doctors had been told to tell their parents to avoid allergens early on. But in about 2015 is when the LEAP trial came out, and that is a famous trial with Bumba, which are those little peanut puffs, that showed us that we could prevent up to 80% of peanut allergies in babies by feeding peanuts early and often. And so since then, there have been multiple studies showing the same thing, and now the guidelines, all the major medical societies, nationally and internationally, have come out with guidelines recommending feeding babies allergens starting at around 4 months of age, and definitely by 12 months, and keeping them in their diet often. And so the issue that we have is getting all the physicians in the country and abroad to adapt these new guidelines, because they're so set in what they heard. And with our topic, with food allergies, there's unfortunately bit of anxiety, and people are scared about food allergies. And so one of the things that we've had to do over these years is make food allergies less scary and spread the word about the new guidelines and the new science.
Well, I said that healthcare is 15 years behind, and you said 2008, so 2023 is your year.
So I've seen the highlights of those slides. Maybe we should put those up, and because a lot of the questions I've got about how have you grown it, who are your partners, I think they're on those slides. So should we light them up?
Sure, Katie, do you want to start with the first
Sure.
couple on this background on the science?
So just with regard to food allergies, currently about 1 in 13 children has a food allergy in the US. And if you think about it, that's about 2 per classroom. So that's quite a few. We've had a major increase in food allergies in children. Peanut allergies have actually tripled in the last few decades. Next slide. And so I mentioned the LEAP trial. You can see it up there on the right side under clinical studies. There have been multiple other studies that also demonstrate that feeding allergens early can prevent food allergies. And so over here you can see all the medical organizations that have come out with new guidelines. And as I mentioned, it's hard to feed babies. Anyone who's tried to feed one knows that. Most of the food, I think, ends up on their face or their hands or the floor and not really in their mouths. And if you look at this percentage over here is from one of the randomized controlled trials, the EAT trial, which had less than 50% of parents who were able to comply with the protocol, which was to feed specific allergens early and often. So we know that it's hard to do. And so that was one of the reasons why we created Ready Set Food, and here's our whole system. And you know, why don't I pass it over to you and you can continue.
Sure. Thanks, Katie. So that's why we developed, really the first part of our system was our patented guided system for introducing allergens through a bottle that Katie was talking about, where you can take the allergenic protein, peanut, egg, and milk, and the exact amounts used in the clinical trials and dissolve it in breast milk or formula. But really our whole goal of all the different products we're going to make is just to make it very easy for every parent to feed their baby the right amount of allergens early and often, because it's both very helpful for food allergy prevention. We can see that on the prior slide, it's recommended by guidelines and prevents 80% of food allergies. And also these are just healthy ingredients for kids to have in their diet. There's been such a big trend towards allergen-free food, which is really wonderful for babies like my nephew or other people with food allergies. But for everyone else, it's much healthier to have all the allergens in your food. And I think we can make babies' food healthier, as well as help reverse the growing food allergy epidemic, by helping make it really very easy for every parent to get allergens in their baby's diet. But I think if you go to the next slide, one of the most important things we've done from the beginning is really bring on the right medical experts, and that Dr. Marks-Cogan, Katie has been a really fundamental part of that from the beginning, helping us build the right team and bringing on people like Dr. Jonathan Spergel, who's the head of allergy at CHOP, or Dr. Pajelek, who's the head of allergy at Cleveland Clinic, and that really making sure that we took the medically correct approach, and that I think there's always a tug of war between things that are expedient for the business and doing things the right way medically speaking, and having one of our co-founders help balance that out medically, but also bringing in additional medical expertise to make sure that we're always doing things the right way has really been fundamental to our success, and what's attracted partners like Johnson & Johnson and Providence Health, as well as the retail partners and the clinical trial partners that we're in partnership with now.
Yeah, being evidence-based, I think, was the most important thing when we were sitting in your living room and just talking about how we wanted to be very transparent and evidence-based. And so that's been really special for us and helpful.
and not to put too fine a point on it, but we had a competitor that raised dramatically more money than we had that used a dose that was 90% less effective, 90% lower than was shown to be effective in the clinical trials, and they went out of business 2 months ago. Just because they, many reasons, but in large part because they didn't have the real support from the medical community. And at the recent American Academy of Pediatrics conference, there was multiple times when speakers talked about how their dose was not going to be shown to be effective, and that people should stick to the doses that were shown to be effective in clinical trials. So it would have been much easier to make a product that had 90% less of the effective ingredient. It's been a real pain in the butt to try and get like enough of the allergen in every dose of every product, but that it's really important, and by taking that approach from the beginning, it's really helped us get some of the success that we needed.
And as the capitalist in the venture capitalists on the stage, I will say, go to their website if you have a child, if you have a grandchild, if you have a niece or a nephew that's in this category, buy them some food. The latest thing is bars, right? They get these nice...
They're really delicious.
Really good. So you've been eating them yourself, huh?
Absolutely. The team has to hide them in the office, actually, because I was eating all the samples.
So I'm sure, I see Mark Cuban companies, reminds me of Shark Tank. I think I'm sure interested in what that experience was like, how it came about. Would you share that with the group?
Sure. So the shortish version, and I'm happy to go into more detail, whatever parts are most interesting, but we kind of stumbled into it a little bit. We talked about potentially going on Shark Tank, but the real reason for us was growing awareness. I think, as Katie was talking about, one of the biggest challenges we've had is that just most parents don't know you can prevent most food allergies through introducing allergens this way. And we were just looking for ways we can leverage, as John was saying, it usually takes 15 years or more for new information to kind of seep its way through, and we don't have the time or money to push that fast enough. So I think that the secret for us has been finding real points of leverage. Going on Shark Tank we saw as one of them, and that by having that platform to spread awareness about food allergy prevention, we were able to just draw a lot more awareness to the cause. But just in terms of how it happened, I'd been on a morning show talking about food allergy prevention, posted it on Facebook, and got noticed by a Shark Tank executive producer who asked us to submit a video, an actual submission for the program, and it turned out that when we submitted the video, they thought it was horrible, but we were lucky that it turns out Mark Cuban's daughter has a food allergy, so they gave us a little bit of a second chance and asked us to remake the video better. So we brought in a videographer and did a more well-produced video. It's funny watching the original versions of the videos we submitted. It's really embarrassing in retrospect, but it's funny how you evolve, and the things that you did back then when you were at a different stage in the business look different to you in retrospect. But
one other comment I was going to add is Katie and Daniel did the filming for Shark Tank. I think it was August, but it didn't go on the air till 6 months later. I could not get anything out of this guy as much as I tried. I wanted to know, did anybody buy? Did anybody invest? And he signed his confidentiality agreement, and we never did find out until the night we listened to the show, and they were actually bidding against each other for it.
Oh, I watched it.
And Mark
It's worth checking
Cuban had a daughter, I think, that had allergies, so. Mark was the one that ended up making the investment.
Yeah, the interesting thing is when we were going through the process, I think each step we're like, okay, we're not going to make it, ha ha ha, that's fine. I don't think we ever really thought and I think the whole thing took, a long time. 10 months. That funnel that you showed was very, very big, and we had to get all the way down to the bottom. And when we went on, we really didn't think we really didn't think anyone would make a bid. I guess Mark is known for questioning physicians and medical products, right? The guy's shaking his head. He's like, yeah. And so we knew that, and we were ready for it. But we were so confident, and we remember walking out. And by the way, you really do stand and the doors open and you walk out and you hear the music And then you stand there and you have one shot to do your pitch, and if you mess up, you don't get another shot. So we did it, and then we got our questions. I think we were standing there for about an hour, but they show you about 2 minutes of all our questions. And we did the science questions for a little while, and then we started getting interest. And I think Andy and I always say, whenever Daniel said, let's make a deal, we were like, we didn't even know what was happening. I think we were like in the twilight zone. Like, what? Mark's walking towards us? What's happening? But it was cool. It was a lot of adrenaline.
Yeah, it was very strange. I think the scariest thing for us, and one of the weirdest things, is that you see it and it's like 10 minutes, but there's an hour plus that you're going back and forth and they're arguing with each other, and they can cut that however they want to edit that. And I think that it's a complicated topic. There's a lot to get right, and I think we were really concerned that Mark's been really aggressive on medical claims and supplements and things like that in the past. But that's, I think, just going back to like why it was so important that we had that sound medical basis, and that we could have doctors come on with us and talk about the sound medical basis. And I think we were just very lucky that Mark already knew about the sound medical basis because of his personal experience with his daughter. So it was dramatically more smooth than I think we expected. But that I think that's really what made us feel like we were confident that we would do well, is that we knew that would hold.
Well, it's a fantastic story. I personally would like to stay all night, but I know that people planned for us to end at 7:30, and I'm a bit of a stickler on that. So I'm afraid we're going to have to bring this to a close. But I promised one question. I don't want to be a liar. First hand up gets to ask the question right here.
Since we have your expertise with the patented formulation system and your expertise from the FDA, can you talk a bit about the patent process, the pros, cons, and as entrepreneurs, what you need to consider and how? And please in a listed format.
Just for those people who couldn't hear, the question is about the patent process, and be very specific about how to succeed.
Very quickly.
Yeah.
So I'm fortunate enough to teach a class in healthcare entrepreneurship. A law firm from Wilson Sonsini, IP attorneys, gave a lecture just Tuesday night. So the short answer is yes, and there's a hierarchy of IP protection. You should think in terms of patent portfolios. In the early stages, you are making sure that you have a defensive moat. John's favorite question is, do you have a moat? And IP is the singular way to do it. There are different types of patents. On the low end, there's copyright and trademark. When you're building a brand, that becomes important. But in the early days, you want the more rigorous patents around your formulations. And I'm sure they got those. And that, quite candidly, is table stakes for any venture grade business like what they've built. You have to have IP. I hope that answers your question.
Sure, and I think the only other thing I'd add, I have almost no expertise in this area, so I think it was very good to have the actual expert go first. But I think that's part of what I would say, is that it's really important to just understand, where you have expertise and where you don't, and also where you feel like you have an ability to flex. Like our third partner, Andy, he's a doctor, but he's spent a lot of time learning about the IP in the area and understanding the process, and then brought on a firm that he worked with to manage that. So I think it's important to have someone internally and not just only outsource it, but also to kind of know your strengths and weaknesses. And I think the last thing I'd say is just that everyone is going to have their own experience in this, but I think our experience has been that small boutique firms can be much less expensive and also spend more time actually knowing your business. And while at some point as you grow, you may need to have reviews from more expensive firms, at least in my experience, we've been able to get people who really understood our business more intimately because they were more boutique and not just about saving money, but also about getting that additional perspective and depth that we might have not gotten from a larger firm from day one.
So John just shared with me, speaking on behalf of the group, that he thought they would be willing to spend a few extra minutes. For those of you that do have places to go and you need to go, we understand, but if there are other people that have questions, we could stay a few extra minutes. So Nobody will be offended if you leave.
So I'll
And
give,
at the
I'll
same
give
time-
those of you who need to leave an opportunity. And while the folks are leaving, Courtney is going to have a microphone. So if you do have a question, raise your hand and she'll bring the microphone to you so that you can ask that question. And again, also if our live stream folks want to drop off, thanks for joining us.
Thank you.
So John, you talked about the 15-year gap in healthcare, and as a now retired hospital administrator, 40-plus years in the business, absolutely saw it all the time. Don't you think a lot of it is because the industry, one of the main tenets is risk aversion and just risk avoidance economically, clinically? And how do you overcome that then? I mean, what do we need to do as an industry to really overcome those two issues, which always used to get brought up, to me at least, when we would have decisions to make?
Well, first of all, your observation is absolutely correct. It's a very risk-averse industry, and the vast majority of C-suite executives are risk-averse. So it's not just that the industry is risk-averse, but the leaders in that industry are risk-averse. If you look at Clayton Christensen's book on disruption, the leading cause of not changing is the established business. So you're absolutely right that the establishment is what's holding things back. What I see changing is world-class technology taking over and moving things much faster than they did in the past. So when we talked about, Kwame talked about Carlsmed, for instance, and iterative scopes, it's called Iterative Health now. These companies have such an impact on the clinical aspects of delivering care, personalized medicine. You can't ignore them now. So Katie mentioned how long it took for the pediatricians to, even though there were standards set, how long it took for pediatricians to change their practice. I think we're seeing that speed up a lot more than in the past. And the other thing is the legal establishment will drive it as well. If the standard in the industry is a certain thing, and you do something other than that and cause a death, cause mortality, morbidity, or whatever it might be, you're going to come under the scope of the legal system. And I truly believe, well, I'm not a big fan of lawyers suing physicians. I think in hospitals, I think the legal establishment will push the industry, because you'll start to see, well, if the best practice for personalized medicine is to take a 3D image of the spine and build a titanium core for that, versus coming in with a box of parts and trying to figure out which part fits in. You've got a strong case for a malpractice. So I think it's a combination of technology, a combination of legal, and the industry starting to change. I don't think it's going to be fast, but the 15-year gap may change, maybe 10 years, maybe 5 years, but it's definitely 15 years behind in any major. You take what the financial services industry did 10 years ago, we're just now doing in the healthcare industry.
Daniel has something like that.
Sorry, go ahead. And I think I agree with all of that. I think the one thing I would add is that a pitch for kind of creative solutions to smaller problems also, because it feels like there's also so many easy things that just get blocked for trivial reasons. So I think I'll just give you the example. I think Katie mentioned that the guidelines on early allergen introduction changed in 2008 to not recommend delay anymore. One of the things we do is work with hospital systems to implement non-branded education and help them teach about the new guidance. But a lot of the systems that we're talking to in 2020, 2021, 2022 still have the old delay guidance written into, hard-coded into their after-visit summaries that are being automatically handed out at every well-child visit. And it's because like no one has the ownership over making sure that well-child visit after-visit summaries have the appropriate guidance in line with medical best practices. Now, I don't know exactly what the solution is. I don't think there's a needs to be an administrator for well-child after-visit summaries. But I think the ability for people within the systems to look around, find creative solutions, and drive implementation of some of the easier things like why we still use so much fax. Like maybe there's some legal things that need to be fixed regulatory-wise, but it feels like just by creative thinking and some entrepreneurship by people who are in the system and use it and really understand it, we can address some of these problems that way too.
Another example that shows change happening is, and I'll let Kwame respond to this, but the FDA is probably the most conservative, risk-averse organization on earth, for that matter. And they went to this whole pandemic with an EUA approach that speeded up the process. We got vaccines out. The United States produced most of those vaccines in record time. And responded to a worldwide pandemic. That didn't happen in years past. So it's an example of a very conservative, risk-averse organization using a new tool, the EUA type of an approach to solve things. You want to respond?
Absolutely. And there are other lesser-known policies that were enacted during a pandemic to address this crisis. One was giving more flexibility for digital health solutions to help people with mental health conditions, anxiety to be specific. Another policy change during a pandemic was to give flexibility in where you could conduct clinical trials. So instead of doing it in a hospital setting, maybe you could do it in a remote setting. So the hospitals could care for the sick COVID patients, and you could still conduct your research, but just not in a hospital setting. So I totally agree. Your tax dollars at work for once.
Perhaps one more. Oh, I'm sorry, Katie, please.
Oh, no,
Okay. Another question? Yes.
The question had to do with some of the things that you've been touching on. For example, shortening clinical trials so that you get an answer sooner about whether something is effective enough or viable enough to pursue, or whether you should abandon the effort. Patient safety, the legal issues, the complexity of clinical trials, the way that you can speed up clinical trials but still do all the patient demographics that you want to in a clinical trial. How do you speed that up and still do everything you want to do in a trial? Meet the criteria for participation, because not everybody can participate in a clinical trial for one reason or another. So my question has to do with a lot of what you've already touched on. So I think it's all relevant. For example, molecules take 10 to 15 years, and if we could shorten the amount of time it takes to get to an answer, you save more lives and you save billions of dollars. Like a cancer molecule, for example, they take too long to get to the answer about whether, most of them fail, 90% of them fail and don't make it to market. Later in later trials, the science doesn't hold up.
I do have something to say. It sort of touches on a little bit of what we're talking about, but these days, I don't know if anyone's here is in medical school or physicians or anything, but it's hard to get good people to go to med school. And I think it's because everyone knows that it's a real struggle and you can make more money going into business. And so I think one of the main things is focusing on how to get good people in medicine and teaching them about business as well, so they have both skill sets, instead of trying to learn like someone like me, right? I basically had my MBA at Ready Set Food. which was great. I was lucky enough to get that. But having the clinicians be part of the innovation is so important, and Daniel touched on that. Like, we are the boots on the ground, and I think a lot of what we've done at Ready Set Food we couldn't do if I wasn't seeing these, food allergic parents and children all the time. So it's just something I wanted to put out there, and that's what we were discussing.
So I think, thank you, and I think I want to thank the panel, John, Laura, and everybody for coming. I found this to be really interesting, and I appreciated everybody's involvement, and I really appreciate everybody's attention. So thank you for being a great audience, and thank you, Laura.
Thanks, everyone, for coming.